Risk assessment. Imagine working in a factory where chemicals are handled daily. What if there were no safety measures in place? Accidents would be frequent, injuries severe, and lives at risk. This is where risk assessment becomes crucial. It helps identify potential dangers before they cause harm. A risk assessment is not just about avoiding accidents, it's about creating a safe work environment, reducing financial losses, and ensuring compliance with safety regulations. What is risk assessment? Risk assessment is a systematic process of identifying hazards, evaluating associated risk, and implementing measures to control them. According to the UK Health and Safety Executive (HSE), risk assessment is a careful examination of what in the workplace could cause harm to people, so that employers can weigh whether they have taken enough precautions or should do more to prevent harm. Risk assessment helps organizations prevent accidents, reduce workplace hazards, and ensure legal compliance. Objectives of risk assessment. Conducting a risk assessment at the workplace helps to comply with safety laws and regulations, reduce workplace accidents and injuries, identify potential hazards before they cause harm, determine the best ways to control or eliminate risk. Enhance productivity by creating a safer working environment. Improve employees' confidence and well being. Types of risk assessment. Risk assessments are categorized based on how risk is measured. 1. Quantitative risk assessment (QRA) uses numerical data to calculate risk performance. Example: estimating the likelihood of a chemical spill causing injury. Applied in high-risk industries like aviation, nuclear energy, and manufacturing. 2. Qualitative risk assessment relies on expert judgment and experience rather than numbers. Example: identifying tripping hazards in an office and rating them as low, medium, or high risk. Common in offices, schools, and hospitals. That is the qualitative risk assessment. The risk assessment process. The risk assessment follows a structured five-step process to ensure all hazards are identified and managed effectively. Step 1: identify hazards. Hazards are anything that can cause harm, such as physical hazards, slippery floors, faulty machinery, chemical hazards, toxic fumes, flammable liquids, biological hazards, viruses, bacteria in hospitals, ergonomic hazards, poor workstation setup, heavy lifting. How to identify hazards. Observing the workplace. Example: checking for fire hazards, reviewing accident reports, past injuries or illnesses, speaking to employees, gathering first hand experiences, examining equipment and substance use. Step 2: identify people at risk. Not everyone faces the same level of risk. Employees, especially those handling hazardous materials, visitors, contractors, suppliers, customers, vulnerable workers, pregnant women, people with disabilities, young workers, general public, people near industrial plants, pedestrians near construction sites. Knowing who is at risk helps in designing targeted safety measures. 3. Evaluate risk and implement controls. Once hazards and people at risk are identified, the next step is evaluating the level of risk and implementing control measures. Is equal to likelihood times severity. Risk level low, likelihood unlikely, severity minor injury, action required, monitor and review. Risk level medium, likelihood possible, severity major injury, action required, implement controls. Risk level high, likelihood very likely, severity fatal, action required, immediate action required. Risk control hierarchy from most effective to least effective. 1. Eliminate the hazard. Remove dangerous equipment or substances. 2. Substitute. Replace with a less harmful alternative. 3. Engineering controls. Install safety guards, ventilation system. 4. Administrative controls. Implement training, safety policies. 5. Personal protective equipment, PPE. Use gloves, helmet, mask as a last resort. Example: if a worker is exposed to toxic chemicals, the best control measure is substitution, using less harmful chemical. If that is not possible, engineering controls like proper ventilation must be placed. Step 4. Record significant findings. Documenting the risk assessment is a legal requirement in many industries. The report should include hazards identified, people at risk, existing control measures, additional safety actions required, date of next review. Step 5. Monitor and review. A risk assessment is not a one time process, it must be reviewed and updated regularly. When to review a risk assessment? After an accident or near miss, when new equipment, chemicals, or processes are introduced, when workplace conditions change, at regular intervals, example annually. By continuously monitoring workplace risk, companies can ensure that safety measures remain effective. Common workplace hazards and their risk control measures. Slips and trips hazard. Example wet floors, platted walkways. Risk control measure. Keep floors dry. Install anti-slip mats. Proper housekeeping. Chemical exposure hazard. Example toxic fumes, spills. Use less hazardous chemicals. Wear PPE. Proper ventilation. Manual handling. Example lifting heavy objects. Risk control measure. Use lifting aids. Train workers on safe lifting techniques. Fire. Flammable materials. Store chemicals safely. Install fire extinguishers. Conduct fire drills. Noise hazard. Example loud machinery. Install noise barriers. Provide ear protection. Electricity hazard. Example faulty wiring, exposed cables. Risk control measure. Regular equipment checks. Proper insulation. Staff training. A risk assessment in a hospital. Scenario: a hospital conducts a risk assessment in its emergency room (ER). The findings include hazard: slippery floors due to frequent spills, people at risk, nurses, doctors, patients, visitors. Risk level: medium, fall can cause fractures or concussions. Control measures: place anti-slip mats, train staff to clean spills immediately, use wet floor signs to warn people. By implementing these measures, the hospital reduces the likelihood of accident, ensuring a safer environment for both staffs and patients. Risk assessment is a fundamental part of workplace safety. By identifying hazards, evaluating risk, and implementing control measures, businesses can prevent accidents, protect employees, and comply with legal requirements. A well executed risk assessment not only saves lives but also enhances productivity by creating a secure and efficient work environment.